Now, absent the rediscovery of Greco-Roman classics and the classic authors, there's little to recommend either the Dark Ages, which we can place 400 to 1000 AD, or the High Medieval period, which would be 1000 to 1300 AD, at least in the field of medicine. This is vividly shown by their dearth of medical discovery and short life expectancy. Even in mathematics, Professor John Durbin lists 36 persons particularly prominent in mathematics between 600 BC and 1700 AD. 14 lived prior to 300 AD, and 22 lived after 1300 AD. None in that 1000-year period interlude. Hippocratic medical practice in the Eastern Roman Empire was never established, and with the fall of Western Roman Empire and the onset of the Dark Ages in Europe, medicine became the work of the layman, usually a member of the local monastery. Medicine as a profession had become extinct. As Dr. Garrison lamented in his famous History of Medicine, in the Dark Ages, the state of surgery throughout Europe, Italy excepted, was worse than had existed at the time of the Trojan War, 2,000 years earlier. But much Hippocratic learning was preserved by 6th century Nestorians in Chandashapur, Iran, passing in subsequent centuries into Persian, Islamic hands, and then slowly re-entering Europe by the 11th century. Humanists then reopened the books of ancient scholarship, but this would have led to little had not medieval Europe retraced the political steps of ancient Hellas, passing sequentially through feudalism, aristocracy, and then tyranny in the guise of the Italian Renaissance. Thus, with a growing population and creation of independent European city-states, there were learned medical practitioners that organized through guilds and university faculties. But instilling the words rather than the concepts of Hippocratic medicine, they produced, even through the 17th century, only the facade of a profession. And I personally do not even count them as physicians, for their prestige and rank at its basis in their ability to memorize classical writings rather than to add to their knowledge. There did occur, however, a transient burst of individualism in the Renaissance, roughly covering the period 1300 to 1600, as select individuals offered a glimpse of the potential for genius that lay concealed for 1500 years. Often independent of ideas handed down from ancient physicians and philosophers, a few individuals were able to initiate studies of their own design. But consistent with the social pattern of the age, fine arts, architecture, music, and science were supported by the patron, a wealthy or prominent individual who afforded both protection and support for his favorites, expecting in most cases some public acknowledgement and secondary gain from his benevolence. Nevertheless, although the patron's support was a vital force in Renaissance discovery, it is shown that Renaissance medical discovery amounted to nothing of consequence for future ages. Well, the vast abyss that was the medicine of the Dark Ages had been traversed. Nevertheless, the impotence of medicine persisted, and so it would remain to the resurgence of individualism as reflected in the 16th century Reformation, the 17th century separation of church and state, to bring forth the 18th century miracle of progress that is continued to this day. When Martin Luther posted his 95 Theses on the door of All Saints Church in 1517, a massive stumbling block to progress was removed. Within 3 years, his message, profoundly aided by the recent invention of the printing press, engaged much of Europe in a reordering of religious institutions. And the power behind this change was recognition of the individual's personal association with God. No longer would the common man and woman be constrained adherents of a pan-European doctrinal kinship distributed among fiefdoms. Now, the importance of the individual was not a new idea in the medieval West. In the 13th century, Thomas Aquinas had viewed each person as having free will. And the classical Greek saying, "Know thyself," was popular. But subsequent to the Reformation and concurrently with the emergence in Europe of elements of democracy, as manifested in 18th century parliaments, a bona fide medical practice appeared, just as it had 2,300 years earlier in ancient Greece. Arising from the plebeian population, the liberated common man and woman now had opportunities for displaying their genius, and this included the field of medicine. It has been my aim in the natural state of medical practice to avoid criticism of religious practices, condemning instead the centralization of authoritarian power within institutions and governments. I must acknowledge, however, that evidence has been presented indicating that progress in the West following the Reformation was due not only to increased independence in the population at large, but also to characteristics of Protestantism as well. The German theologian, Dr. Ernst Troeltsch, provided the classic defense of this proposition, concluding that it was the escape from medievalism, a consequence of the, quote, religious individualism, quote, end quote, of Protestantism that contributed to our modern world. Calvinism, he pointed out, arose to contrast with the authoritarian premises, manorial world, and compromises of Luther. Troeltsch agreed with Dr. Max Weber that the ethico-religious spirit of Calvinism had a spatial significance for the capitalistic spirit. On the other hand, to be fair, the Catholic historian Christopher Dawson in 1947 wrote that it is almost an historical accident that our scientific age coincided with man's abandonment of spiritual order, meaning the medieval period. Well, whatever the relevance of Protestantism, Northwestern Europe and Great Britain were the principal sites for the reincarnation of the Hippocratic koinon. Autonomous professional organizations then appeared throughout Europe and the United States, and medical journals improved the work of the profession. Discoveries would now be vetted by the new koinons, and physicians began to successfully compete with the medicine men of their day. And there were many. Evidence shows that it was the unencumbered physician and his organizations, not the medieval universities, nor the Renaissance patronage, that would bring about a second approximation to the natural state of medical practice. And so, let's consider the eminent Cambridge physiologist Sir Michael Foster's statement that, quote, "It is one of the lessons of history of science that each age steps on the shoulders of the ages which have gone before," end quote. And this is shown to be humility misplaced. Herein is found support for the assertion that modern medicine would have progressed to its present point even without Hippocrates or the Renaissance. It is shown in the natural state of medical practice that in each of the 3 eras, Greco-Roman, Renaissance, and modern, equivalent discoveries were not only made, but were made independent of any prior discoveries and without sophisticated technology. A logical corollary is that many seminal discoveries and inventions of the 18th and 19th centuries could just as well have been made prior to the Common Era, had freedom for the individual and for group associations, the koinons, prevailed in the Greco-Roman world. I give many examples of this in Volume 1. But among those many examples, let me give 4. There is in the Archaeological Museum of Rhodes a series of 6th century BC quartz lenses with graded focal lengths engraved on their frames. They are thought to have been used to make fine jewelry. And a Cretan quartz lens from the Greek Archaic Age was found to have an approximate magnification of 20x. Now, a 20x magnification permits recognition of blood flowing through capillaries of a living frog's web, well within the range of a jeweler's loupe. Given a bit more time, such lenses would surely have been applied to human anatomy, lesions, sputum, urine, and the like. And consider the finding of proteinuria, or protein in the urine, an important clinical marker for a variety of common diseases, especially types of kidney disease, and one that has been useful in guiding therapy. The Hippocratics noted an increased foaming when the urine from some patients was shaken, and they did associate it with kidney disease. Theophilus, in the 7th century AD, noted cloudiness on heating the urine of some patients. Paracelsus in the 16th century noted the addition of vinegar to urine of some patients caused cloudiness. And about 1800, several physicians associated the heated or acidified urine precipitate with the edema and other disease states such as Bright's disease. In effect, proteinuria was diagnosed in all 3 eras. Now, the ability to semi-quantitatively test for proteinuria over time, even if the cause of the cloudiness was unknown, would have been a technically simple test for following certain kidney and other diseases to see if dietary manipulation or medicines might be useful. But the important point here is that proteinuria was detected by 3 different techniques in 3 different eras using different procedures. Given time and sufficient observations on patients, basic information related to pathophysiology, treatment, and epidemiology of many diseases would have been obtained. Consider further 2 of the recognized founders of modern medical practice. Dr. René Laennec was raised by his great uncle, a priest, after his mother died when he was 5 years old. And he is praised for invention of the stethoscope. But by applying the ear to the chest wall, the Hippocratic physician localized pleural effusions and heard friction rubs. For the first time in 1628, William Harvey reported similarly listening to heart sounds. Then in 1818, Laennec reported his invention of the stethoscope. Wanting to listen to the chest of a young woman, he decided to roll up a pamphlet of paper with one end on her chest and the other applied to his ear. He found her heart sounds were better heard. He then made wooden models. Great popularity of the stethoscope followed. But that is not the reason Laennec is considered one of the founders of modern medicine. While hearing chest sounds are indeed improved, as late as the 1930s, there were still some modern physicians who felt that applying the ear to the patient's chest was every bit as good as a stethoscope for clinical purposes, and a cardiac usefulness for the ancient technique was reported in the journal Circulation in 1975. But the great step forward was Laennec's extensive association of his stethoscopic findings with the clinical status of his patients, and from findings at autopsy, and this was published in 1819. And so the very valuable auscultation of the chest using different techniques occurred at varying times over the many centuries, but its value ultimately resided far more in the acquisition of clinical data than the physics of the stethoscope. And this the Hippocratic physicians would have done had their initial efforts continued unimpeded. And then there was Leopold Auenbrugger, 1722 to 1809, son of an inn owner who invented, in quotes, the physical examination technique of percussion, a technique his father used to judge the fluid level in casks of wine. But the 2nd century AD physician Aretæus had distinguished ascites from tympaniotes by a form of percussion, and it is likely also that the Hippocratics did so, inasmuch as they were able to differentiate ascites from tympaniotes. And percussion of the skull had been used by cowherds in the 17th century to detect intracranial tapeworm cysts in animals that were treatable, temporarily at least, by drainage. But it was Auenbrugger who, over 7 years, collected detailed observations on his many patients and correlated percussion results with the clinical status and autopsy findings, publishing them in 1761 in a small volume of 95 pages. To summarize, scientific auscultation and percussion of the chest and abdomen vastly improved the understanding of the internal status of the body, with ramifications in medical and surgical treatments prior to invention of the X-ray machine in 1896. The stethoscope, per se, was little more than an innocent bystander. It was instead the careful clinical observations on many patients by Laennec and Auenbrugger that proved their usefulness and provided the stimulus for further scientific discovery and invention, something that could just as easily have happened in ancient Greece, given but a little more time. And add to this the probability of a primitive clinical microscope and a simple semi-quantitative test for proteinuria, there's little question but that a revolution in clinical medicine would have been at hand. The role of medical journals in the history of medicine has received inadequate attention, for it is the medical journal, as the mouthpiece of the modern medical koinon, that contributed so much to bringing back the natural state of medical practice, whereas the Renaissance inventor and his patron relied on distribution of a relatively small number of books, usually written in Latin, to a relatively small number of friends, associates, and prominent persons. The democratic and vernacular medical journal was available to professionals in all reaches of society. The phenomenal result being that koinons now had an international range and were thereby internationally productive to the benefit of all mankind. But progress is not inevitable, and the authoritarian is again on the march, this time on a global scale. Today's phenomenal technology of medicine is a product of capitalism and will thrive only within a capitalistic system. And the natural state of medical practice, which is the stimulus for that technology, is the product of a free society. The physician's responsibility is solely to the individual patient, not to an organization or to the government. Today, the practitioner finds himself increasingly regulated, and it is ironic that the regulation stems from the profession's increasingly porous boundaries. Medicine's immigrants are becoming medicine's masters. The Hippocratic Oath is increasingly irrelevant. The work of the profession is ever more performed by those with inferior training. The professional organization is diluted by non-physicians. Medical practice is managed by non-physicians. Medical care is distributed by non-physicians. And with the prize of medicine ever more fame and fortune, the attractions of a career in medicine are those more like a business or a competition rather than a profession. The root of medicine's internal problem lies not with those outside the profession who seek advantage in a medical alliance. It lies instead with the profession that seeks them out. The koinon that guided the practice of medicine from superstition to science must redefine its limits, and reversing a 60-year trend in America, cease being bigger and start getting better. The root of medicine's external problem, on the other hand, is centralized federal government management of healthcare, the economic, regulatory, and bureaucratic consequences on the medical professions, accessibility, innovation, distribution, quality, flexibility, responsiveness, and attractiveness as a career are potentially deadly. Not to mention the broad and inevitable consequences of government inefficiency, corruption, and most importantly, massive mistakes. Medicine cannot be practiced by a committee.